Unfortunately, I have no PPEs. None. Home care providers are frontline healthcare workers, and we have no equipment to protect ourselves. We can't even go to the store and buy a mask or gloves with our own money because the shelves are empty. If our work is essential, our health and safety should be too. I am a mother, and as of Monday, because I do not have any PPEs and worried that I could possibly pass this to my daughter is being watched by my mother-in-law, who is 70 years old. I had to drop my daughter off Monday, and I have not been able to pick her back up to make sure that they stay safe because I'm afraid.
We are all currently working 12-hour shifts, and we are asked to only use one surgical mask per shift. Last week, we were just approved to use cloth mask, and that is not acceptable. As we see, we need this essential equipment to be able to handle the surge and anticipate all the people that are going to be coming in. Every time I leave home, I have to say goodbye to my family, not knowing when I'll see them again. We don't know what each day holds for us. We might at any point be mandated to stay at that hospital. But I feel it is my responsibility as a healthcare professional to show up and care for patients and my coworkers, and to accept the risks that come with the job. If I could say one thing, I want to say the same thing that Governor Kate Brown said. Please, everybody, do your part. Stay home. That way we can protect our patients and ourselves.
Healthcare professionals like myself are working in conditions right now that put our lives and the lives of our family on the line. Irene's story was really touching to me because I also have a young child at home. I have a 2.5-month-old infant. And I'm also living with my mother-in-law, who is in her late 60s and at higher risk. I'm 35 years old, and for the first time in my life, I've considered whether or not I need to write a will. I'm already anticipating that I will likely be infected because I lack basic protective equipment. Due to lack of personal protective equipment, healthcare providers around the country are being asked to use masks for an entire shift, sometimes up to a week. And these masks are meant to be used once per patient encounter. The repeated handling of these masks increases my exposure, increases my risk of infection and transmission to others, including my patients that don't have COVID-19. And one of my colleagues and I have been lucky so far. We have no doubt that one of us is going to fall ill very soon. But despite all of this, we show up to work every day because we took an oath to provide the best care possible. But when our healthcare professionals become patients themselves, it's going to limit the number of staff that can continue that care.